sat down just last week with a doctor to discuss the management of PCOS for women not trying to conceive.
Salome PCOS helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with Salome. Your journey matters.
Understanding that reproductive wellness and health is not only important for women trying to conceive, but equally as important for women not trying to conceive, as it contributes to their overall wellness. Now joining us to discuss the management of PCOS for women not trying to conceive is gynecologist and obstetrician Dr. Tladi Motsema. Welcome to the show.
Welcome.
Now, Doctor, I just kind of want to break down, how is PCOS diagnosed?
Okay, firstly, PCOS stands for polycystic ovarian syndrome. And as we know, a syndrome encompasses a lot of conditions. So how is PCOS diagnosed? Generally, we still use a certain criteria called the Rotterdam criteria. It's actually an old system which was formulated in 2003, but we've not changed over the years. So it encompasses three components. The first component is what we call N or oligo-ovulation, where people either don't get their periods or get very few periods within a year. We generally will say at least about 8 periods a year. The second criteria is the ultrasound criteria, where we look at the ovaries and we look for these polycysts. The third criteria is we look for what we call clinical features of hyperandrogenism. So androgens are your male hormones, namely testosterone, DHEAS. So the clinical features will be those things which you will see and you look at the person and see. For example, one is hirsutism, where you've got facial hair, hoarse voice, just like males. And also you'll find that they will have very macabre, truncal obesity. Then when we look at the biochemical, which are tests which we do, we're also just looking for all of these chemicals, like your high testosterone levels. Sometimes we use AMH, we use FSH-LH ratio, so those are biochemicals. When you come to your doctor, most people will come with either infertility, that is the most common, where they are unable to conceive, or they will come with these symptoms of not having their periods regularly. Okay. Some of them will come from the physicians because of this extreme weight gain. So diagnosis is based on that. If you have 2 of those, then we regard you as having PCOS.
Understood. Now, so why is it so important to diagnose and treat PCOS? And what are some of the risks if someone doesn't treat this condition?
Yeah, definitely. It's it's extremely important. Remember, with PCOS, I said it's a syndrome. So it affects all aspects of life. In a female. It affects not just the female, but also the extended family. As I've mentioned, the things which it does, one of it is infertility, which is a big problem. So in terms of infertility, it does break families. That's number one. But the main one is because of what we call metabolic syndrome. So metabolic syndrome is where you have the central obesity, and you also have what we call hyperinsulinemia. Essentially, it is having very high insulin in your system, and this has an effect on your cardiovascular. Cardiovascular is your heart and your vessels. So we are prone to hypertension. These individuals are prone to diabetes.
The risks are severely high if someone doesn't diagnose and treat PCOS, which just leads me to my very next question. What are some of those treatment options?
Yes, the treatment options is, one is, for females, I would say the first thing is they need to come through if they experience all of the things which I've mentioned, because we know that 50% of these females are undiagnosed. Yeah. And generally when they come with the problems. So the treatment options, I would say it's a multidisciplinary. As I've just alluded, that it affects almost the entire body and also affects the extended family. So essentially, it includes us as gynecologists, because most of them will come to us for the infertility and also for the period issues. It also affects a fertility specialist for the fertility component. It affects a dietitian who will try to look at the diet. Also affect psychologists.
Of course.
Because they suffer from low self-esteem. Some of them will get depression from the in-laws saying, why is she not falling pregnant and so forth. And also it also affects physicians because they have to look at this hyperinsulinemia, glucose, and monitoring the obesity and all of those things. So having said that, with all this team, we now look at, we divide it into what we call a lifestyle or non-medical treatment, and lifestyle is the cornerstone.
It looks like it's, Doctor.
Yes.
It seems as if this multidisciplinary approach to treating PCOS is absolutely essential. But not only that, having support in the house is also as important. So please may you make sure that you reach out to all those that might be struggling with this condition and lend a helping hand or ear. Thank you so much, Doctor, for joining us.
Thank you.
Now, our journeys are all unique, and it's always important to understand that the journeys of others as well. With Salome, your journey matters.
Cysts in the ovaries, irregular or missing periods, and high male sex hormones are symptoms of polycystic ovary syndrome. If you experience 2 of these 3, you may have it. It's also the leading cause of infertility in women. Salome Fertility helps regulate ovarian function and helps improve fertility. Salome PCOS helps regulate menstruation and reduces the male sex hormones. Get the help you need for PCOS with Salome. Your journey matters.